Hello. Today I will talk about fractured pelvis or pelvic injuries. Pelvis. So, where is it situated? It is situated right below the spine. It's attached to the tailbone and it's right above the femur or the femurs. So when you zoom in, you can see that this is the sacrum, which is the triangular shaped bone. This is the coccyx, that's like underneath. That's the last tailbone, and this is the pubis, and this is the ilium and ischium, but it's not important right now. And this whole thing, it's called the pelvis. So, why does it happen? It happens because of some sort of disruption of the bony structure of the pelvis. And it doesn't usually happen. It only happens to like 4% of adults. It might happen because of traumatic high energy accidents or events like falling from very high place, or in older people it can just happen because of falling, because of their weak bones, which happens because of osteoporosis. And pelvic injuries mostly happen because of motor crashes, car collisions, or any sort of accident that happen because of vehicles. It might also happen during childbirth, which it doesn't always happen, but it might happen, and surgery is needed. So here's the male pelvis and here's the female pelvis. There's no point of this actually, but I just wanted to put it there because they're both similar. So yeah. Okay. The bones that are affected by this injury are the ilium, ischium, pubis, which are the hip bones, and the coccyx and the sacrum. So here's the fracture, and here's another fracture. The pelvis, it's like a combination of many ring kind of bones. So when the rings get away from each other or separate from each other, this might happen. Okay, so there are different types of injuries. There are different types of pelvic injuries. There's type A, which is when the sacroiliac complex is intact. As you can see here, it's still okay. It's probably just a simple or hairline fracture. And then there's type B, which is the partial disruption of the sacroiliac complex. As you can see here, it's a little wider than this one. So it's like something happened and it moved away, or it broke or something. And then there's type C, which is the complete disruption of the sacroiliac complex. It looks painful, I know, it looks very painful. So, and then there's another kind of injury or fracture, which is called the open book fracture. It happens when you hit really hard on the groin. What happens is that the left and the right halves of the pelvis are separated at the front and the rear side, and it definitely requires surgery because it's serious. It's very serious. So there are a few ligaments that are affected because of pelvic injuries. So there's the sacroiliac ligament, and there's the sacrospinous ligament, which is here, and there's the sacroiliac coccygeal ligament, and there's the sacrotuberous ligament, and then there's the inguinal ligament and superior pubic ligament, and there are a few other ligaments that are affected by pelvic injuries. Okay, so there are serious complications that happen due to this injury because it's the pelvic area and it has so many internal organs, and when something happens to that bony area, it actually affects the organs inside, which, because the pelvic bones are supposed to protect the internal organs, so when something happens to the bones, it affects the organs. So I actually read somewhere that internal bleeding happens. So it's like excessive bleeding of internal organs, or rectal bleeding, or loin bruising due to retroperitoneal bleeding, neurological and vascular abnormalities in one or both legs, because the bones are supported. The bones of the legs hold the hip bones, which is the pelvis. Instability in hip adduction and pain in hip motion. I think this is the mild case. And then there might be vaginal bleeding in women, which also is caused by internal bleeding, because of internal bleeding. And then there's urethral injury in men, and then there's hemorrhage, and healing and recovery time. So it usually takes 4 to 6 weeks if you choose to get the surgical way out. So pelvic stabilizations are used, such as external fixation, which happens when holes are drilled into the uninjured areas of bones around the fracture, and then special bolts or screws or wires are screwed into the holes, and outside the body, a rod or a curved piece of metal with a special ball and socket joins the balls to make a rigid support. As you can see here, these are the holes, the screwed holes, and these are the screws or metal rods, and this is the support, so it holds the pelvic bone together. And then there's internal fixation, or it is also called open reduction internal fixation. It involves the implementation of implants to guide the healing process as to enable or facilitate healing. Like this. It's done internally. Can you see the pins? It's inside, so it's not like external support. It's the support is given to the bones internally. And then there's traction. It is the straightening of broken bones by pressuring the spine or skeletal system. So there's this thing, there's this machine, you can buy it online or anywhere, and you put the belt around your hips or the pelvic area, and then they pull it. So it's like rehabilitation, it's like a therapy, but it's used to. When it comes to physiotherapy exercises, bed rest is a must, and it usually takes 3 to 4 months to heal, because you're not doing anything. And once the fracture is healed enough, you have to stand up with the help of a physical therapist, and then start walking, maybe with a walker or help of somebody, or keep walking so that the area keeps moving, and then you can process to a cane. And there are exercises such as this. So you bend your knees, of course with the help of somebody professional. You can do it alone, and it helps with the movement, and you don't really lose anything. So that's it. Thank you.